Hi, I'm Laura. I'm here to talk to you about our virtual poster on the real-world evidence demonstrating clinical utility of the bacterial fluorescence imaging to guide treatment decision-making in 283 wounds. So in this poster, we've collected real-world evidence, and what we've done is we've asked clinicians to look at clinical signs and symptoms of infection and compared that to fluorescence imaging using the IX. And then we evaluated how fluorescence imaging information was able to guide the clinician's treatment plans. So this work was collected from 32 different sites across 14 states in the US, and we had 58 different clinicians participating in this. And so what they did is they inspected the wound for clinical signs and symptoms, and then they made a very rough treatment plan of what was going to go on during that visit. And then we came in with our fluorescence imaging device, the MolecuLight, and took a fluorescence image. And in that image, if the clinician saw red or cyan fluorescence, that was indicative of bacteria at moderate to heavy loads. And then with this information, the clinicians had the opportunity to revise the treatment plan if they wanted to, based on this additional information. And so these are the results. We had 283 wounds. There was no exclusion or inclusion criteria. It was really all comers. And so we had a wide mix of different wound types. 30% were diabetic foot ulcers, but we also had venous leg ulcers, surgical site infections, pressure ulcers, even a few burns. And what we found was that the majority of the wounds had some evidence of red fluorescence, indicating bacteria. So over half of the wounds had just red bacteria, but close to 75% had some sort of fluorescence that suggested bacteria at these moderate to heavy loads. And so cyan indicates Pseudomonas aeruginosa. Almost 10% of the wounds had that, and then around 14% had a mix of both red and cyan. Now, if you compare that to what the standard of care showed, clinical signs and symptoms, the clinicians only detected about 26% of the wounds as having some sort of bacterial load. So that means that fluorescence imaging detected 48% more wounds with bacteria in it that were undetected by your typical clinical signs and symptoms. So that's increasing the number of wounds with clinically significant bacterial loads by 2.8-fold. So that's very significant. And then furthermore, based on this information, 57% of the wounds had some sort of change in treatment after the fluorescence imaging. Most of the time that included further, more aggressive, more targeted debridement, but also affected where there were cleaning, changes in dressing, and antimicrobial prescribing. So what was very interesting as well is that this data also correlates very nicely with a lot of the literature that's out there currently, with very similar increases in bacterial detection as well as changes in treatment. And so in conclusion, fluorescence imaging more frequently detected bacteria in wounds than your typical clinical signs and symptoms assessment. And this technology is real-time, allows the detection of bacteria, and it's very easily incorporated into routine assessment. And this information can really guide treatment. And this is across multiple wound types and patient populations.